Pregnancy is a time of growing new life and of dramatic change in a woman's body. It is also a common time of aches and pains for the pregnant mother. But does it have to be? Are the common complaints of back and pelvic pain and other common pregnancy discomforts treatable? How can physical therapy help an expecting mother? I'm Destiny Boshinsky, a doctor of physical therapy at Scripps Outpatient Clinic in Encinitas. And today we'll explore how physical therapy can help promote a more comfortable pregnancy for you. This is Preggy Pals, episode 77.
Is that a plus sign?
Pink or blue? Hospital or home birth?
What type of food should I be eating?
I think I just peed myself. I'm pregnant, and I have to exercise.
What pregnancy glow?
Wait, was that a contraction?
Gotta make these pants fit. I've got kinkles.
What do you mean there's more than one?
You've got the symptoms, and now you've got the support you need for a happy 9 months. This is Preggy Pals, your pregnancy, your way.
Welcome to Preggy Pals, broadcasting live from the Birth Education Center of San Diego. Preggy Pals is your weekly online on-the-go support group for expecting parents and those hoping to become pregnant. I'm your host, Annie Laird. Would you like bonus content after each show, great giveaways and discounts? Then join our Preggy Pals Club. You'll also get a free subscription to Pregnancy Magazine. See our website, preggypals.com, for more information. Another way for you to stay connected is by downloading our free Preggy Pals app, available in the Android and iTunes marketplace. If you don't live in San Diego but you want to be a panelist on our show, you still can be. You can participate through our virtual panelist program. Our Preggy Pals producer, Stephanie, is here to tell us more about it today.
Hi. Okay, so we just want you to like our Preggy Pals Facebook page and follow us on Twitter. And when you use Twitter, please use the hashtag PreggyPalsVP. We will be posting sneak preview questions on Facebook and Twitter about the week before we record our shows. And we'd love to have your input. For more information, you can go to PreggyPals.com under the Community tab, and you'll find Be a Virtual Panelist for more information.
Great. Thanks, Steph. Well, today for our panelists, we have Sunny and myself and Stephanie, and our expert panelist for today, Destiny Boshinsky. Thank you for being here today. So let's go around and just to introduce ourselves. I'm Annie Laird. I'm going to be taking over at the beginning of the year once my baby is born and Sunny's babies are born. So I'm going to be taking over hosting duties on Preggy Pals from Sunny. I'm very excited about it.
I'm excited too.
Yeah.
I'm excited to pass the torch.
Yeah. Sunny's going to be still involved as she'll go into with New Mommy Media as the business person. I just get to sit here and do what I do best, which is talk a lot. So and facilitate discussions, which I think I'm really going to enjoy. So we're starting here before the babies come, to just get me into that. So again, my name is Annie Laird. I'm 35. Occupation, my day job is a government contractor. My due date for my third baby is mid-October-ish. We don't know the gender of the baby. We're going to find out then. I have two other children, two daughters, my 8-year-old Clara and my 1-year-old Lucy. And I'm planning a home birth.
All right. Hey, everyone. I'm Sunny, and I just get to sit back and be a panelist today on the show. So excited. I am 35 years old. I'm the owner of New Mommy Media, which produces Preggy Pals, Parent Savers, the Boob Group, and coming in January, Twin Talks, which is all about twins. And the reason we're launching this show is because I am pregnant with twins, and there's not enough information online about being pregnant and raising twins. So we're hoping to change that. I have two little boys at home, Sayer, who is just over 3 years old, Urban, who's about to be 17 months, and again, pregnant with identical twin girls, so I get the other side of the gender here now. 2 boys and 2 girls, and then we're done. We're done having babies after this. And these babies are going to be born via cesarean due to some complications I had with my first baby, and real excited about it. The C-section date has been scheduled for December 2nd, which puts me at about 38 weeks, so fingers crossed. Everything's going really well with the pregnancy. Babies look great. They're at about the 51-52% mark for twins at this age, but they're doing everything they're supposed to be doing, and so I'm hoping that I can hold out as long as possible. Stephanie.
Hi, I'm Stephanie. I am 30, and let's see, I'm a producer for Preggy Pals, and I have a baby girl at home. She is 8.5 months old. Really am looking forward to this episode because I wish I had looked into physical therapy during my pregnancy with her.
Before we start today's show, we have sometimes on Preggy Pals, we go through different news articles of interest. So this is a recent news article. It just came out here in the past week. And the title of the article is Drinking Milk in Pregnancy May Lead to Taller Children. So it's based on this.
I love it.
Exactly. And that's what I need in my family because I'm 5'9", my husband's 6'3". So, we need to really have some giants in our family. So this study apparently shows how we can further do that. So I can contribute to my basketball team height of children that I have. So, but anyway, so this study, it's a very long-term study. It was over 20 years.
Gosh.
Right. And it was in Denmark, and they followed 685 mother and child pairs, and they tracked the mother's milk consumption when she was pregnant. So most of these moms drank low-fat milk, and it was only 5 ounces a day. So very small amounts, and we can talk about that here. Just I know that at least in my first pregnancy, I was encouraged to drink a lot of milk. I mean, more than 5 ounces a day. What they found was that these mothers who drank just 5 ounces a day had bigger babies on average. And then they tracked them up to age 20 and found that the children were on average almost a half-inch taller. And this was taking into account, family history and all these other type of nature versus nurture. So, tall parents, are naturally going to have taller children. But what they're saying here is that even taking into account all of that, mothers that drank more milk during pregnancy had taller babies and taller children and bigger babies at birth. So, yeah. What do you guys think about that?
Okay, a half-inch, that's kind of negligible, isn't it? I mean, that's a little...
Yeah.
It's not like you're talking like, hey, you're going to be 6 inches taller.
Exactly. Is that really statistically significant? I don't know. Yeah.
But I am lactose intolerant. But when I was pregnant, I was not. And I drank so much milk. Mm-hmm. Like, that was...
Did you crave it?
Yes.
Yeah.
I wanted it. Chocolate milk. Whatever. Milk is milk, right?
It's like a candy bar, but it's healthy.
Yeah, for sure. So, and I think that's interesting. I mean, my daughter was 7 pounds, 11 ounces.
Oh, so very average size baby.
So, yeah, she wasn't small or anything.
Right.
So, and she was born in 5 days before her due date. So,
yeah. Sunny, I know you don't have children up to the age of 20 yet. Maybe when Preggy Pals and New Yummy Media is going on in second decade, we can talk about this and bring this article back up. But I mean, what did you find as far as the size of your babies, of your boys?
They were actually pretty big. My first was really big. He was born 9 pounds 2 ounces.
Yeah, and I guess I should ask, what was your milk consumption? Like, did you find
average? I'm not like a huge milk drinker, but during pregnancy, I do get milk cravings. Mm-hmm. So I just kind of drink whenever I can.
See, for me, that's ice cream, but that's a little bit different.
Oh, yeah. So,
I like
Ben and Jerry were my friends.
I like that, too. And I do like this study. Like, the women in my family are shorter. And like I said, I'm pregnant with girls this time. So I feel like they're at a slight disadvantage. I'm 5'4" if I stretch in the morning. And I feel like, my whole life, I have a background in entertaining. And I always wanted to be a Radio City Rockette. And you have to be 5'6" to be a Rockette.
Yeah.
So I was kind of like doomed. Like, there was no way I was ever going to be a Rockette. So maybe if I drank more milk, maybe my girls.
Your mom should have drank more milk.
Well, a little too late for that. But maybe for my girls, maybe they can be Radio City Rockettes if I just drink a little bit more milk.
Well, what's so interesting, because for my first pregnancy, I drank a lot of milk. I mean, and I didn't even like milk. Unlike you two, I didn't have those milk cravings. I would chug it like, I was in college, like chugging a beer, except it was milk. And I didn't really enjoy the process. Yeah. And my first daughter, when she was born, she was 10 pounds, 4 ounces.
Oh my gosh.
So it was interesting in talking with my midwife. I said, I know that I can push through my pelvis a 10-pound plus baby, but let's try and not do that again. So
please,
what can I do? And she mentioned the milk drinking. She said, it's not mentioned in the article, but what my midwife said was that milk basically converts over into sugar, and that basically contributes to the larger weight of the baby. And so it was so interesting. So I was like, awesome, an excuse not to drink milk. Great, I'll get calcium from other sources. And I did. Second daughter was born, and she was almost 2 pounds less.
Wow.
So, yeah, very
and
interesting.
And they were both girls, so,
both
same
girls.
gender. Okay.
Mm-hmm, both girls, same gender. I mean, one was 41 weeks, the other one a little past the due date. So not terribly, before the due date. So I really attribute it to just different nutrition, but to specifically the milk drinking. Well, today on Preggy Pals, we're discussing how to manage pregnancy discomfort. Now, this is a new series here in San Diego, and throughout the nation, women are interested on how do I manage just some of these common pregnancy discomforts in a more natural way. And so today, what we're looking at the start of our new series, using physical therapy. Our expert today is Destiny Bashinsky, and she's a doctor of physical therapy. Destiny, welcome to the show. Thanks for joining us.
Thank you.
Destiny, what are some of the common conditions that you see prenatally that women come to you for physical therapy?
Well, of course, I see a lot of back pain and pelvic girdle pain, which can be anything from sacroiliac joint pain, coccyx pain, pubic symphysis pain, groin pain.
Check. As you're going through this, I'm like, yeah, I know.
All of the above.
Right.
Anything from the waist to the knee, essentially.
Yeah.
Sciatica. A lot of people experience as their pelvises expand and muscles get stretched their limits, then they can start compressing nerves. And so sciatica is just one of the nerve entrapment syndromes that we kind of call them, that people can get. A urinary incontinence. I see less of that during pregnancy. I think mostly because people don't necessarily talk about it as much to their providers as they do the pain, and it's
well, it's considered like the popular thing to do. I know of like comparing all the aches and pains, and so definitely those are the ones I think within my mommy groups of like, oh, my back, oh my sciatica, all that.
Yeah, and I do get some women with abdominal diastasis. These isn't usually like the primary thing that they come to me for when they're pregnant, but it can definitely be a contributor to discomfort and a lot of tension and discomfort in the front of the abdomen.
Right, and you touched on it a little bit. So what causes all these pregnant, all these discomforts? Obviously you're pregnant, but like what physically in the body is going on that makes that happen?
So there's a lot of hormonal changes that contribute to a lot of different things. So one of the big things is joint laxity and weight gain. As your relaxin levels are what contribute to loosening up the pelvic joint and the ligaments, but it's not limited just to the pelvis. It's everywhere. So your back, your knees, your ankles, your wrists, everywhere gets a little bit looser, and those levels actually rise and they peak in the first trimester at 12 weeks. So people can start feeling discomfort from laxity early on. And then the more weight you gain, the more stress there is on your joints. So you've got this combination of looser joints with increased stress through them,
right,
which can create a lot of discomfort and stress and strain through them. Then you've got all the postural changes that happen when you're getting this big belly and big in other places. And those shifting, our muscles aren't really prepared necessarily all the time for that shifting. So it can put more strain on our muscles and joints. The baby's position can actually have an impact. As the baby's growing and moving and your uterus enlarges, the ligaments that attach the uterus to the spine and the pelvis start stretching and pulling. And then the baby's position can have an impact on discomfort in the back or the pelvis.
Right.
And activity levels. Along with pregnancy symptoms. A lot of people have a harder time during the first trimester exercising. So because you're sick all the time, you feel exhausted. So during that first 3 months, sometimes if you're not exercising as much, you can get a little bit weaker.
Right.
And you're not in as great a shape as you were previously before getting pregnant. So that also contributes. People who are like profusely vomiting all the time also, that can put a big strain on your neck and back and pelvic floor, just the pressure of vomiting quite frequently.
Yeah.
And of course, swelling.
Yeah. Well, something I wanted to ask you, because you've had 2 singleton pregnancies, and now that you've having your twin pregnancy, have you noticed a difference with your pregnancy discomforts? All these things that Destiny is talking about here, have you noticed more aggravated symptoms here or more conditions?
Yeah, for sure. And everything's just earlier. Stuff that I would normally experience in my 3rd trimester was early 2nd trimester. The first thing I noticed was, along with my little waddle that I started to get early 2nd trimester, was just like a pain. It was a sharp pain as I was walking, and I was told that it had something to do. I don't know if they're ligaments. I don't know if I'm using the correct terminology, Destiny, but something that it felt like my perinatologist was trying to tell me that when you walk, it's like, it's kind of like a seesaw, like, back and forth. And it was just tugging on something. And so I would get these sharp pains. And again, this is pretty early on in my second trimester. That's the first thing I noticed. But I just feel like everything is more aggravated earlier on, which actually really worries me. I'm like, I'm just now at the start of the third trimester. And it's like, I don't know what to expect past this point, because this is where I usually am right when I'm ready to give birth.
Right at the end, yeah.
So I'm going, oh my gosh. There was one thing that I was going to ask you, Destiny. One thing that I struggle with, and I seem to notice it when I'm trying to get out of bed. So I'm exerting a lot more. I know when that happens. But I'll go to get out of bed, and I will notice like this sharp pain in the pubic area. Do you know what that could be caused from? And is there anything that, can be done? Is there anything I should be doing to correct that?
Is it right in the center? Like right
it feels
at
like
your
it's on
pubic?
the side,
It's
actually.
on one side.
Yeah.
Like more kind of toward your groin in the pubic?
Yeah.
There's a ligament called the round ligament that can create a lot of groin and pubic area pain that connects the uterus.
Okay.
In the labial region, and that can get really pulled taut, and it can be really uncomfortable turning over in bed, getting up from a chair. So sometimes you see the typical pregnant woman like struggling to get up and pushing and like okay,
right.
That's like round ligament pain.
Okay.
Can be really common with that. And there's a lot of different strategies we can use to help mitigate or eliminate and minimize the pain when you're transferring and moving around, that kind of thing. But there's just so many ligaments involved there that's, and it also, if it's central, it's like right in the center, the pubic symphysis, where the two sides of the pelvis join in the front, those can separate. In fact, one of the jobs of relaxin is to help those separate from when you have the baby, so allow the baby to pass through. When those separate, they can start shifting and becoming a little less stable, and that can create pain, especially when you're rolling over or standing on one leg, walking, that kind of thing.
Well, and that's my next question too, is so you're pregnant and you're dealing with all these pregnancy discomforts, and then the birth happens. What do you see women postpartum for? What are the kind of common complaints or issues that they're dealing with?
So any of the other things that we've been talking about this far can continue postpartum. People don't have the ligament pain as much. That goes away because your uterus is returning back to its normal size and position and shape.
From the watermelon to the pear.
Right, exactly. So you don't get those internal things quite as much. But it depends on what kind of labor and delivery you had. If you had significant tearing, or some women have separation of the pelvis in the later stages of pregnancy, things don't just rebound right back to where they were. It takes its time to heal. So I can see women for any of the things that we've been talking about pain-wise, in addition to pelvic floor pain, urinary incontinence, fecal incontinence, difficulty getting back to having intercourse comfortably, any of those things.
Yeah.
Yeah.
When we come back, we'll discuss what's involved with the physical therapy treatment. We'll be right back. Welcome back. Today we're talking about managing pregnancy discomfort using physical therapy with Destiny Bashinsky. Now, Destiny, what does a physical therapy treatment involve? So a woman comes into your office, what should she be expecting?
So the first day we do an evaluation. It's all the treatment is individualized depending on what's going on with her in particular. So we do an evaluation to see what's most likely causing the pain and discomfort, what things are contributing, and then how do we begin treating it. Typical treatments can involve manual therapy, which involves joint mobilization, massage, tissue work, stretching, those sorts of things. I do a lot of taping with my pregnant women, just to first as a trial, but for pain relief and positioning. There's a lot of different taping techniques and different kinds of tape that can help with that. Bracing, lots of bracing too. Sunny mentioned earlier, like binders. There's abdominal binders, there's pregnancy supports, there's pelvic girdle supports. There's a lot of different things that can help with the discomfort and support you. And a lot of education, a lot about like how to move, how not to move, what to do, how to modify what you're doing so that you're not aggravating the condition and making it worse as you get further along. How to get help, essentially, because when you're having pain, especially early on in a pregnancy, you shouldn't be expected to do it all. and I think too often we are.
Right.
And it's really important that we use those resources and get help from our families and friends to make sure that we take as much load off of our bodies as possible so that they can handle the increasing stresses as you get further along. Do lots of body mechanics education and training, making sure you're moving well, not putting increased load through your low back, that kind of thing. For my pelvic floor women, I do biofeedback, which is a EMG electromyography where I put little sensors on the pelvic floor to make sure the pelvic floor is coordinated and contracting correctly and everything. I'll do that prenatally and postpartum, but prenatally mainly for women who have incontinence issues, pelvic floor issues, because we can't do an internal assessment or treatment, and lots of exercise and homework.
Yeah. Well, it's interesting you mentioned the education part of it and it being a lifestyle change.
Oh, yeah.
Of, it doesn't end when the woman comes in your office and she leaves the office. I guess I think physical therapy, I think something from like a Rocky movie where, getting stronger and he's running up the stairs and it's all about, I think that's what I think a lot of people think with physical therapy is that you're doing these exercises and you gut through it and it's painful. Right. And some of it might be. But is physical therapy painful to get?
It shouldn't be. You're coming to me, especially at this time, for this kind of issue. You're coming because you have pain. You shouldn't be put through more pain. In some instances, if you've got like really tight muscles that have been stretched and we need to work through that, then those can be tender. But I'm not gonna, have you screaming in agony on the table as it's not the way it is.
Yeah.
Most of it, the vast majority of it, should be pain relieving and very comfortable, and you should walk away feeling better than when you came in.
Great. Now, is physical therapy during pregnancy, is it a one-time treatment or do women come to you multiple times for treatment?
It depends. It depends on what they're coming for and what helps them. Sometimes it's as simple as getting the proper bracing and support and teaching you body mechanics and sending you on your way. And that would just involve a few appointments. If that's successful and you can continue doing that and, manage the rest of your pregnancy, then great. Other times it's kind of an ongoing weekly basis to help you manage those, if say you get like 2 or 3 days of relief after your physical therapy appointments and then things start piling up again because either you can't stop work yet or you have 2 toddlers at home or whatever, then you need to come in regularly so I can help you manage that better and give you some more relief so you can do the things that you need to do.
Well, good. Now, I know a lot of our listeners, they're concerned about budgeting for baby, getting ready for baby and all these different things to buy. What's the cost normally involved with physical therapy? And is it covered by insurance generally?
Almost most insurances cover physical therapy to some degree. There's usually copay, and those are always on the rise. And co-insurances, it's ever changing. So most likely it'll be covered by insurance, at least to some degree. It's depending if you have an HMO, they might limit it to a certain number of visits or something.
Right.
But, yeah.
Great. Wonderful.
I have a question. So for the treatment, and it may depend on, what you're trying to treat and all that kind of stuff, but how much of this is stuff that we need to do on our own? Like we go to an appointment and you mentioned homework. Yeah. So I'm thinking, oh my God, homework. I feel like I'm back in school again. How much of this is stuff that we need to do at home versus stuff that's just done in the office?
A lot of homework.
Okay.
Aside from like exercises and positioning and everything, you're going to learn things that you can carry over into to how you move at home that don't seem like homework, but you're gonna have to remind yourself to think about it because how we move has a big impact on how we feel. So that's homework, just learning how to do things. But there are exercises. There's going to be other things that I give people to do, like get in the pool. That's my number one recommendation for pregnant women is get in the pool and take the weight off of your body. And so there's definitely some time juggling and time management, especially when you have other kids.
Yeah, right.
So yeah, there's more homework. I mean, if you think you're in physical therapy for 1 to maybe 2 sessions a week, the vast majority of your other time is spent on your own. Okay. So there's a lot of things that you have to do to manage it.
Okay.
So Destiny, I didn't have as much of like the back pain or the pelvic pain in my pregnancy, maybe a little bit, but nothing that I couldn't deal with. But for me, torturous carpal tunnel.
Right.
So apparently I have a lot of fluids.
You were really swollen.
Yeah. Well, I wasn't though. That's the thing. I mean, I guess I was swollen, but I wasn't excessively swollen, not to like a dangerous, level, but it affected my hands so badly. And I was desperate. Like, I didn't know what to do, and I ended up not doing anything and just like suffering through it. And I had to leave my job 2 months early. I just couldn't open, a bottle of water.
Right.
Like, I had a hard time doing anything. I couldn't do anything that involved tying my shoelaces or anything like that. So is that something that physical therapy can help?
To a certain extent, yeah. Physical therapists treat carpal tunnel all the time, and occupational therapists treat it as well, hand specialists. And usually when they treat non-pregnancy carpal tunnel, it involves it's usually people who have highly repetitive manual jobs.
And that was my job too. So it definitely
played a role, right?
It definitely aggravated it, but I never had a problem beforehand.
Right. So we can't do a ton about the systemic swelling that you're having. I mean, that's something that you talk with your doctor about. How do you better manage your swelling, and how is that playing the biggest role?
All they said was wear a brace. Oh, okay. Well, that did nothing. It made it more uncomfortable.
Oh, okay. Did you have nighttime bracing or anything like that?
I tried, but then
that was worse.
As it was, I couldn't sleep, and then to sleep like this, no.
Yeah. So, there's definitely different things that we could try as far as treating the carpal tunnel itself, and bracing is one of them. Manual therapy is one to help release compression in the area, mobilizing the joint so that gives you a little bit more space and flexibility, even though you are having that swelling in there. And, give it a shot. And see.
It was just amazing, though. Like, as soon as I gave birth, like, my hands
went
were
away.
normal. And I'm like, whoa. Yeah. I can feel my hands are I was so nervous about delivery, too. Because, you always hear, like, you got to grab onto something. And I'm like, I'm not going to be able to grab anything. I couldn't hold my husband's hand without it. I couldn't do anything without it hurting.
Yeah, and you can get that in the feet, too. It's called tarsal tunnel.
Oh, I've never heard of that.
I have a patient. I had a patient who had both. She had carpal tunnel and tarsal tunnel.
Like
both sides.
In pregnancy or
in
just
pregnancy?
Oh God. Mm-hmm. Oh man.
Yeah.
Wheelchair or just
yeah.
So we also have a comment from one of our Facebook friends. I asked for our Preggy Pals virtual panelist questions. If any of our Facebook friends had used physical therapy in their pregnancy, how often they used it, and if it was a one-time thing or a continuous therapy. And our friend Melissa said that her hips separated completely during her last pregnancy, and she had extreme pain. And she did physical therapy 3 days a week for 3 months, but found it was only making the pain worse, so she stopped. And then she roughed it out for the last 2 months. What do you say for that?
There's a wide range of practitioners out there, like any profession. And depending on the condition, we can have limited effectiveness. And she mentioned hips separating. I mean, I don't know what exactly that means, if she's referring to her hip joint or her pelvis or where, but there are certain times and conditions when literally, we can't fix things, and we just can try to make you comfortable until you have the baby. And sometimes women just need to have the baby, and then things get better. So, without more information, I can't speak directly to that, but there's a wide range.
And I think there's always going to be naysayers, not saying that she is, but I think there's always going to be people that want like more of a quick fix, honestly, as opposed to going through a process. And I would imagine you would face that a lot, Destiny, in your profession.
Oh, especially with all the homework.
We
want to do it.
We are a instant gratification society.
Yeah.
Absolutely.
We want a solution right away. In a previous episode, we talked about chiropractic care, and I had a similar experience, not 3 months, but I went to a treatment with one chiropractor and was in a lot of pain. So for me, the solution wasn't, well, let's just drop the chiropractic care. It was, well, let's find a different chiropractor.
Right.
And
I think it with that too is that if, as a practitioner too, if I'm not making a difference for my patient, I'm not going to keep seeing them. Yeah, right. I'm going to say, I'm not being effective for you. You need something else. You need to either see an acupuncturist or a chiropractor, or go back to your doctor and get something more effective for you. Right. This isn't necessarily the treatment for you. Mm-hmm. And I think that's, any practitioner within there, who's aware of their limitations and everything should be giving that same advice to people.
Exactly. Good. Well, thanks, Destiny, for joining us today. For more information about Destiny and her practice, as well as information about any of our panelists, visit the episode page on our website. This conversation continues for members of our Preggy Pals Club. After the episode, Destiny will share some tips on preventative measures pregnant women should take to avoid some of the common discomforts of pregnancy. To join our club, visit our website, preggypals.com.
We have a question from one of our listeners, and this comes from Heather. Heather writes to us on our Facebook page. She says, we are pregnant with our first child, and I've heard a lot of good things about these natural organic toys that you can buy that are supposed to be better for your kids and the environment. Is this true? I also know they tend to be more expensive.
This is Julie Valise, child safety expert. Heather, there are a wide variety of products available on the market for newborns, and all of them have strict regulatory rules which prohibit the use of many chemicals in a children's product. Manufacturers must have these products certified and tested to make sure that they meet all applicable standards and regulations. Many products we knew of when we were children are still available today, but it's most likely that they have gone under many different redesigns to remove certain chemicals from the products. Organic products are made and marketed to meet the requests of many new parents just like you. These products are often a little more expensive, but not always. So when choosing products for your child, it's just as important to look for those products that will help engage, assist, and encourage your child's development at every stage of their life.
Well, that wraps up our show for today. We appreciate you listening to Preggy Pals. Don't forget to check out our sister show, Parent Savers, for parents with newborns, infants, and toddlers, and our show, The Boob Group, for moms who breastfeed their babies. Next week, we're talking about water births. This is Preggy Pals, your pregnancy, your way.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
Hey mamas, don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.